Good morning, everyone. And welcome to the ALS Association Wisconsin Chapter's 12th Annual ALS Care and Research Symposium. My name is Lori Banker-Horner. For those of you that I don't know, I'm hoping to get to know you today. I'm the Care Services Director with the ALS Association Wisconsin Chapter. We have a wonderfully full program today, and we really hope that you get a lot out of the program, that you have a chance to learn some valuable information and gather resources that you can take home with you today. And also a chance to really meet some wonderful people that are here. So I encourage you to mix and mingle and learn about the people at your tables. I wanted to give you just a little bit of a history for those of you that maybe this might be your first time here. We held our first symposium in 2004 in collaboration with Dr. Paul Barkhouse and our developing ALS clinic team at Froedtert Hospital. It was a point we got to the point that we were growing. We were still just the small Southeast Wisconsin chapter, but we wanted to be able to have a venue, bring everybody together to learn together. And that was in 2004, and here we are in 2016, and the development of this is amazing. Like I said, we were the Southeast Wisconsin chapter. As you all know, we're now the Wisconsin chapter. And we truly do have representation from throughout Wisconsin. We have people, we have a full table from La Crosse in the middle here. We have representation from Eau Claire, from Madison area, Green Bay, Appleton, Oshkosh. We're representing everyone, and that's our goal as we move forward as a chapter. I want to welcome Dr. John Ravitz. He traveled from San Diego, and we're very happy to have him here today. I had the benefit of listening to him yesterday as he gave grand rounds at the Medical College of Wisconsin, and I think you'll really enjoy hearing from him today, and we're so glad that you could join us. And glad you saw some sunshine yesterday. So we are also, as you heard from Melinda Kavanaugh before, she took our kids downstairs. We're so pleased to be able to hold our youth program for the first time. We're really recognizing the need to really support our kids and really understand their perspectives. And this is the first time. We're so thrilled. And you're going to hear from Melinda a little bit more on that this morning. We also, as you can see, and I know that you've been filling up your bingo cards, we have a wonderful group of exhibitors on the periphery of the room. I really encourage you to meet and learn from each of them. Some of them have been with us since the beginning, since the very first symposium. They are true partners with us. We collaborate with them in a lot of different ways, and they're here to support. So please, we actually have expanded the time. We realized from your feedback that you wanted a little bit more exhibitor time. So we have, at lunchtime, there's going to be a little more time for them. I want to remind you they will not be here at the end of the program, so if you don't wait to fill up that card, okay? Just make sure you get the names and everything before lunch is over, because they will be closing up before the end of the program. And if you have any questions on bingo, I'm sure Janet, I'm not sure where she is, but she will be, oh, there she is. She will be happy to answer any question you have, right, Janet? Okay. And then you all received a program booklet. That booklet we put together so that you can leave here with all the contacts for the exhibitors. That's really important, so in case you didn't get a chance to talk to them today, you'll be able to reach out to them. And also, Steve, our videographer, is in the back. I just want to point out that throughout the day, I have to take cues from him as we move forward, and sometimes I'm not so good at hearing him. So if he starts waving wildly, let me know. We'll be using that video we found last year. It really worked well. We have a link that we were able to post on our website and on YouTube, and you're able to watch it again if you wanted to listen to something you thought you missed or you wanted to share it with somebody. Also, we have a few housekeeping items. I think we have a men's and women's bathroom, a general bathroom right outside the doors here, but there is a family bathroom outside in the hallway to this end. So that's large enough to accommodate larger wheelchairs and if you need assistance. And the temperature in the room is always an issue. We tend to start out really cold, and then it gets warm, and then it gets cold again. So please do not hesitate to reach out to one of our volunteers in case you're getting chilly, and we'll watch as well. And also, we have some continental breakfast items, so feel free, don't hesitate, help yourself in the back, and enjoy. We just want you to be comfortable throughout the whole day. So, without further ado, let's start it off. First person I would like to introduce to you is our chapter executive director, Melanie Roach-Bicos. And Melanie is a fundraising extraordinaire. She's an amazing collaborator with our community partners, and we would not be what we are today if it wasn't for Melanie. So, Melanie.
Thank you very much for the nice introduction, Lori, and thank you to Care Services for putting today on. It's so important. I promised Lori I would keep this really short because I know there's bigger and better things that are going to be covered today. I just wanted people to take a look at their table. We have put for everybody an event guide. And these are events that our chapter produces throughout the year. And we would invite you to please join us at whatever events you can. It's the idea that we are all in this fight together, and we need your participation at these events. We are louder and stronger together. October 9th is our Milwaukee Walk to Defeat ALS. You can register a team now. If you don't do the Milwaukee Walk, there's an Appleton Walk, a Platteville Walk, and the Janesville Walk is in 2 weeks. All the monies raised from these walks stay in Wisconsin to help Wisconsin ALS patients and their families. So we see it as supporting our own. So we would really ask you to get involved. That we have a Chasing a Cure event with the Milwaukee Brewers, a number of things. We try to do events where there's a place for you and something that you would enjoy. So please take a look at this. If you ever have any questions, ideas, thoughts about any events, please reach out to us. We're here, and your feedback makes us stronger and better. So I hope you enjoyed today. Thank you for coming, and we look forward to seeing you down the road.
Thanks, Melanie. This next speaker is someone who I have to admit continues to amaze me with just his commitment to this chapter and the ALS community. Tom Kettler is the president of our chapter board of directors. He's been a member of our board since 2010 and was elected as board president in 2014 and has just recommitted for our second term, which we're very pleased about. Tom also serves as the chair of the Wisconsin chapter's Public Policy Committee. He was elected to the Board of Representatives of the ALS Association National Office and appointed to the Finance and Strategic Planning Committees, which we were very pleased about with the Ice Bucket Challenge and all of that. So you know that there's somebody good behind the scenes. He also serves on the ALS Association National Office's Board of Trustees. I had the honor of getting to know Tom when his wife Sue was diagnosed with ALS and watching a wonderful partnership that humbled me. So I am so pleased to introduce Tom Kettler.
Thank you, Lori. Good morning. It's a pleasure to be here again. I always look forward to the symposium because it gives us a chance to share information and to give you a little information and to also ask for your help in our advocacy efforts. One of the primary missions of the ALS Association, national as well as state chapters, is public policy or advocacy. And through our advocacy efforts, we've been able to achieve several accomplishments that have assisted the ALS patients in waiver of 24-month waiver of receipt of Medicare benefits, As soon as you're diagnosed, veterans now are immediately eligible for their benefits, and so there's a whole list of things that we've accomplished. Each year, I lead a group from Wisconsin to Madison to Milwaukee, and then we go on to Washington from there. But we have an opportunity to go up on the Hill and meet with our congressmen and our senators to talk about our priorities that we have established through a listening tour throughout the country, so that we kind of condense the more important priorities that we have. This year, we have, along with as part of our delegation, we have Kelly Bauer from Janesville and her husband John. We have Betsy Burning of Racine and her friend Nancy Thompson from Kenosha, who will be going along with us, as well as Melanie, Susie, and Natalie from the office are coming along this year to really add firepower. So we're going to be talking with our congressmen and senators a week from Tuesday in Washington. Our priorities this year are a couple that you've heard before. And we have the ALS registry, and we also have the ALS research program at the Department of Defense. And both of those were enacted into law a few years ago, but they have to be refunded each year, so we go and ask for reappropriations. So we're asking for $10 million each for each of those projects. In addition, we're going to be asking for a waiver of the 5-month waiting period for the receipt of Social Security disability. And the reason for that is that it's when this was initially enacted, that you could receive SSDI, the thinking was that, well, we're going to wait for several months just to make sure that the diagnosis is correct. We are going to ask for a waiver of that, and we're looking for a legislator to sponsor that legislation for us. And then the fourth thing is Medicare has had an agreement with Congress for many years that they would not submit to a bidding process for complex rehabilitation equipment for wheelchairs. And Medicare has changed their stance on that. So we are now going to go through Congress to persuade them that we are going to ask them to change see the error of their ways and change that back to the way it should be. There's already legislation underway for that. Tammy Baldwin has already signed on as a co-sponsor for that legislation, and so we're going to go and thank her, and we're also going to try to persuade Ron Johnson to also sign on as a co-sponsor of that. To that effect, at that table back there, we have our advocacy table. There are letters to both Ron Johnson and to Tammy Baldwin. We're going to ask everyone here to get those letters, fill in your information, sign it for us, and then we will hand deliver it a week from Tuesday in Washington. Those things are extremely persuasive. We like to have nice, thick stacks of letters. So please, if you would do that for us, sign those at that table. We also have volunteers. Gary and Heather are back there to help anyone who has not signed up for the ALS registry yet. And this registry we feel is extremely important. It's an extremely important piece of research which is nationwide. And that's so they're there. If you have not already registered as a patient in the ALS registry, please see Gary and Heather. They will help you to do that. So thank you very much. We look forward to getting to Washington a week from Tuesday and bringing back some money. Thank you.
Thank you, Tom. As you can tell, retirement has not been boring for him. So I'm very pleased to introduce our next speaker, Dr. Paul Barkhouse. I have personally worked with Dr. Barkhouse for over 15 years, and he continues to also amaze me with his commitment to ALS and our patients and families. Like I said, he was the driving force of our first symposium 11 years ago, and he continues to be each and every year. In fact, I know probably before we leave today or maybe tomorrow, he will be talking to me about what we could do next year. So I know that's a given, but that's what keeps us going. Dr. Barkhouse serves over 200 individuals throughout Wisconsin and southern Illinois, and I believe even in the UP. And the care that my knowledge and watching him every day is his care is unmatched. Dr. Barkhouse is a neurologist and professor of neurology at Frederick Hospital and the Medical College of Wisconsin. He is the program director for clinical neurophysiology at the Medical College of Wisconsin, and he was responsible for the establishment of the ALS clinics both at Frederick Hospital and the Milwaukee VA. And under his direction, we've received the initial certification of our clinic at Frederick in 2006, and it was recertified in 2014, and it continues to grow and grow every day. So without further ado, Dr. Barkhouse.
Good morning. I'm going to keep my remarks very short because we have an extra speaker this morning. So our update is all good news. The program continues to grow, although we're relatively stable, serving about 250 patients with approximately 25 over at the Vets Hospital. The biggest news in the past year is, since the last symposium, is the recruitment of Dr. Dominic or Nick Fee. He is not able to be here today due to a prior commitment, unfortunately, but he'll, I'm sure, be here next year or at one of the next functions. He comes to us from the University of Kentucky. Most recently, although he is actually a graduate of the training program out in Madison and originally an Iowa boy, so he's more Midwest. So he's a very good fit and a good partner, and he's the associate program director, and some of you have already met him because we're now kind of sharing the clinic on alternate weeks. So he'll see the follow-up patients or established patients on one week, and I'll see new patients on that morning, and then alternately we'll flip the next week so we all kind of hopefully know everybody. That's a big help to me because before I was seeing new patients usually on my administrative time on a Friday morning or else in the Thursday or Friday at 4:30 or 5 o'clock in the afternoon. So it has made my days a little easier, definitely. And he also brings a lot of talent and experience, also in particular with respect to genetics, and Dr. Ravitz will be talking a lot about that this morning, so you understand how this type of disease is going as far as how we're looking at it and thinking about it as far as future research. Otherwise, we've continued to be reasonably active academically in research. Our program in Munich, the motor unit indexing that some of you helped in, has continued to catch on and is now being considered as being preferable to the other techniques in motor unit estimation as far as looking at how efficacious a drug might be as far as drug trials. So I'm happy to report that's continued to catch on. It took a long time to persuade people, but better late than never. And we are involved still in a drug trial now, the tirasemtiv trial, which is not directly an ALS-specific drug, but is sort of an adjunct drug to help the symptoms. And Dr. Ravitz is involved in that trial as well. And we have other endeavors going on, as you already know, with dental care and Dr. Kavanaugh's research with children. And then in the past year, I've gone over to the other side of the campus to where our basic science colleagues are. And Dr. Ebert couldn't be here today, but I'm going to introduce her collaborator in a moment to tell you about what they're doing, but we're also doing some basic research with them, and I hope that will continue to grow because it's really got to be a partnership, very much like where Dr. Ravitz is in San Diego. So without further ado, I'm going to introduce Emily Seminary, who is a student in Dr. Ebert's lab. Dr. Ebert unfortunately couldn't be here today. She's a graduate of Augustana College in Rock Island, Illinois, and comes from Illinois. She's currently at the Medical College of Wisconsin in the interdisciplinary program in biomedical sciences and cell biology. And along with other students, they're helping us work with research and gathering specimens that you are all contributing, namely mainly blood, and looking at a cohort or group of patients with ALS from one geographic area. We thought that would be of interest because, as you know, we Midwesterners don't move around too much. We're kind of anchored, whereas in other parts of the country, it's here today, gone tomorrow. So anyhow, I'll have Emily say a few words.
Thank you. So like Dr. Barkhouse said, my name is Emily Seminary, and I'm a second-year graduate student at the Medical College of Wisconsin. And I'm here today to talk a little bit about what we're doing from a basic science perspective to try to understand exactly what's causing ALS. So ALS can be classified as either sporadic or familial. If a patient does not have a family history, then they're considered to have sporadic ALS. And exactly what's causing these cases is still, unfortunately, unclear. It's likely that it's a combination of different genetic and environmental factors, but again, it's not really clear at this point. And for ALS, about 90% of all patients are classified as sporadic, whereas the remaining 10% who do have a family history of the disease are considered to be familial. And these are the genetic cases of ALS. And what's really interesting from a basic science standpoint is that over 20 genes have been identified as causative for ALS, and this number is likely only to increase because a small percentage of familial patients do not have a mutation in one of these 20 genes. And to make matters more complicated, the prevalence of these genes vary greatly, and they don't seem to be doing the same thing within the cell. So the main question we have as basic scientists is, how do these different mutations all form and cause the same disease? So here's just a little table, I'm not sure if you can read it much, of all of these 20 genes that have been identified in ALS. The research primarily has focused on these three genes, which is SOD1, FUS, and TAR-DBP. And the reason these were the focus of the research for the past few years is because these were considered to be the most common causes of familial ALS. And then in 2011, a new gene was discovered called C9orf72, and that very quickly became the most common cause of a familial ALS, which is one of the genes that we will be focusing on in our lab. We're also going to be focusing on a more rare mutation called optineurin. And by studying a really common mutation and a very rare mutation, we're hoping to determine what mechanisms are common to the disease as a whole or what could be specific to different mutations. So a little bit more about C9orf72. As I said, it's now considered to be the most prevalent cause of familial ALS. And while we know it is a protein, we don't actually know what it does, unfortunately. But upon its discovery in 2011, it wasn't very well characterized. And while research is being done right now to try to figure out what its function is, we don't have an answer at this time. And one of the hallmarks of ALS is the presence of these protein aggregates in this cell, which are just different proteins that kind of clump together that can really gunk up the neurons. And that could be the cause of the neurodegeneration in these forms. Optineurin, as I said, is very rare. It causes only about 1% of familial ALS cases. And if you consider that the familial cases are only 10% of the population as a whole, optineurin only is responsible for 0.1% of all cases of ALS. It is involved in the breakdown of the proteins and the mitochondria, which are the powerhouse of the cell. So it is likely that the breakdown of the process that gets rid of proteins could be what's causing ALS. And what's really interesting is that optineurin has been found in the protein aggregates across different cases of ALS, so it does point to a certain commonality between the different mutations. So the way we study ALS in our lab is through the use of induced pluripotent stem cells, or iPSCs. So what we can do is we can take a skin sample or blood sample or urine sample from a patient who has been willing to donate that to us, and we can treat them with factors that will then trick them back into thinking that they're stem cells. And so now we have stem cells from a patient, and we can drive them towards motor neurons, and we can study your motor neurons in addition to the lab. And so then we can study human disease in a human system, which before this has not really been possible. So the goal of my whole dissertation and my time here at the medical college is to try to determine similar and dissimilar mechanisms of ALS that are caused by either C9orf72 or optineurin. And to do that, we're going to be generating these iPS cell lines and then look at what is functionally wrong within the motor neurons themselves, as well as one of the supporting cells in the nervous system, the astrocytes, and try to again determine what's causing this disease. So to do this, we're collaborating with the ALS clinic over at Froedtert Hospital. And so if a patient comes in and they are volunteering to participate in our study, they give a small blood sample as well as any family member that comes with them that also wants to participate. And then I just come up and pick up the blood sample, and I can go ahead and isolate the DNA from the sample. And then I screen through the cohort to see if we have any patients with the mutation that we're interested in. Unfortunately, I ran into a little bit of a technical snag, so I've been slowed down, unfortunately, in this process, but we think we have it fixed now. So I'm screening through these patients, and we're hoping to find some patients with the mutations we're interested in. We do know that since enrolling in our study, one patient has undergone independent genetic testing from a genetic counselor, and they came back positive for the C9orf mutation. So we do know that we have at least one patient that has the mutation that we're interested in, so we're likely going to be talking to them as soon as we've identified that person ourselves. So like I said a couple times now, the optineurin mutation is incredibly rare, and so we're not likely to find a patient with this mutation. So we're going to be utilizing the genome editing technique called CRISPR-Cas9 in order to make the optineurin lines ourselves. Now, you may have actually heard of this technology before. It's generating a lot of buzz in the scientific community because it's making genome editing incredibly simple and incredibly specific. CRISPR acts as a molecular scissors that are specific to a certain region of the genome, and then all we need to do is just treat the cells with this CRISPR. It'll cut out the DNA that we are interested in and make the mutations that we want. So in this case, I have a little schematic here. We want to cut out that region called exon 5 in the optineurin gene. So we've designed CRISPRs for either side of it, and then that'll just cut it right out for us, and then we have an ALS optineurin line. So just to summarize, again, what we're going to be trying to do in the lab is we are generating these optineurin and C9orf cell lines, and then we'll be driving them towards either motor neurons or astrocytes. Motor neurons is the picture on the left, then the astrocytes are the one on the right. And so by looking at these different cell types, we can see what's wrong with the motor neurons themselves, which are the cell type that's lost in ALS. And we can also see what could be wrong with the astrocytes. While it's not normally the cell type that's thought about when you think of ALS, astrocytes are an incredibly important cell type in the brain, and in fact, their health has been shown to influence the health of different neuron types. So it's possible that the astrocytes could be contributing to the disease as well. We also want to look at the mitochondria, which are the picture in the middle there, again, which is the powerhouse of the cell. Mitochondrial defects have been found in a number of neurodegenerative disorders, including Parkinson's and ALS. So we want to see what's different about these mitochondria in our cell lines and what we can see. And by, again, looking at all of these different things, we're going to try to figure out exactly how the ALS disease is caused. So that was a very short talk, but that's all I've got. I just wanted to thank my lab because they're really, really helpful. The different technical help I've had to getting new protocols underway. Of course, the ALS clinic at Frater, Dr. Barkhouse and Lynn Wheeler. Any participating patients and their families, I really appreciate you guys trusting me and donating your blood samples to us at the ALS Association, our collaborating labs, and my funding from Advancing a Healthier Wisconsin. Thank you.
We'll do some questions. I think there will be time for questions. I'm going to defer it till just a little bit later, if that's okay. Hold the questions, scribble them down. We won't leave any questions unanswered. The only ones we never answer, as I tell students and residents, is the one you didn't ask. So at least we try to answer them. Yes, this is a wonderful collaboration, and I look forward to seeing hopefully some results blooming away, although like anything else, it does take time, and as Emily said, it is a group effort. It's a tremendous amount of work. Next, I will introduce our Melinda Kavanaugh. Melinda, where are you? Oh, there you are. It's sort of glaring back there. You all know Melinda from before. She's at the University of Wisconsin in Milwaukee and is piloting our work with youth, and I'm going to have her say a few words.
Thank you very much. Thank you. Thank you. So I'm actually going to set a timer. Yeah, I can talk. Actually, one of my students is in the audience, so she can share my excessive chatability. So thank you so much for having me come and give you guys just a little bit of an update. Two things. First of all, downstairs we're doing Youth Day, which is the culmination of a lot of conversations, a lot of research, a lot of discussions with families. And right now we have 5 youth down there who are just really engaging with each other, engaging with durable medical equipment, talking about ALS, talking about their families, and it's just really an extraordinary thing to be a part of. So I wanted to say that that's going on, and for those of you who have families, who have youth at home, and maybe didn't know about it, certainly this is something that we're going to continue doing as a chapter, so just wanted to put that out there. So I'm going to give a very brief update. So a couple of years ago, I did a small pilot project here in Wisconsin interviewing 19 kids who had a family member with ALS. And from that pilot study, the National Association was very intrigued because of the results. So we found that kids are really, really, really engaged in caregiving and supporting and involved with their families. And one of the things that ALS Association on a national level recognized is that that was a bit of a gap in their education and programming and materials. And so one of the things that I've been able to do is start this national study to where parents can fill out an online survey and then youth are interviewed as a follow-up. So right now, the study's still going on. So right now we have 87 families involved in this study. Right now we've completed 25 interviews with youth, and we have 15 more to be interviewed. You'll notice that they represent quite a few families, but we have multiple kids in the families participating in these surveys. Something I put up there is that 5 parents declined to have their youth be interviewed out of some concerns around not wanting their children to talk about ALS. They feel like it's maybe a little too early. They're concerned about upsetting their youth, which are absolutely valid concerns. But when we get to talk to the youth, a lot of the things we find is that the youth know a whole lot more than their parents think they do because they're going on the internet, they're talking to other people, and yet these kids say definitively that they want to talk to their parents about it. So one of the interesting, nice pieces about this is that we're seeing the importance of communication in families. I put down at the bottom of the slide that 35% of the families identified having a child in the home being their caregiver. And again, it's a conversation that people struggle having because they are concerned about, what do I tell someone that my child is helping out? How do I talk about that? And that's something that we certainly explore in the survey, how parents feel about it, how family members feel about it. Really briefly, the majority of children are helping to care for a parent, but we do have quite a few grandparents in the study as well. So the kids engaged in the survey are ages 8 to 18. These are some of the things that they identified doing. So it's really across the board. They're helping to feed, they're doing a lot of housekeeping, right? They're assisting with a communication device. And this is a really interesting piece that I'm thrilled to be able to have the folks downstairs working with our youth on how to understand communication devices, what it means, what it doesn't mean. And some of the results that we're finding is that kids are really struggling with the difference in the voice of the communication device versus the voice of their parent, and what that means for that relationship, and really the importance of having conversations early around voice banking, and really getting that family engaged around what is the role of the actual sound of the parental voice. Kids are also doing a lot of things around helping their parents move, get around, walking, transferring, and also medication. This is a very important piece and something that could really benefit from further study is what is that role of medication? What is it that young kids are doing to engage, providing medication, doing shots, doing pills? What is it that they're doing? And what does that mean to them and what does that mean to the family? We asked some questions about what they know about ALS. And the reason why I asked this is that this really touches on how we, as the ALS Association, as the National Association, can create educational materials that are targeted to youth, which is one of the gaps in how we engage families. And asking them these questions, we see that they have a variety of information about ALS. Some of it is very inaccurate, including that it's rare for a girl to get ALS, right? So these are things that are directly stated by youth that when we ask, what do you know about ALS? This is what they think they know. So this helps us guide how to develop educational programs, how to target what they do and don't know about the disease itself. Then we asked what it's like to be a caregiver. And the thing that is so extraordinary and really powerful, and I hope that we all take away from this, is that there are some very clear positive aspects of caregiving. And the last thing I want to walk out of here is that everybody thinks that it's just some horrible process for these children, and it's not. It is stressful and it is difficult, which really leads to the need to provide education and provide support for them and provide opportunities like we're doing downstairs today, to where these kids are just having a good time, but they're talking about the things that they're doing. They're talking about their lives in ALS, but they also are talking about the really positive things. It makes me feel good. It makes me feel like I've done something to help somebody. And that's something we really need to embrace and acknowledge, that there are some absolutely wonderful positive outcomes. But one of the powerful questions we asked is, what do you need to help take care of your family member? And these really lead to training, teaching, guidance, and advice. So they actually say, I need someone to teach me how to do it, right? I need someone to teach me to give advice, to give assistance, instruct me how to do it so I don't hurt them. And it was powerful because this slide, this information, again, really informs what we're doing with youth downstairs now, is that we have all these wonderful suppliers and providers of durable medical equipment who are downstairs now helping kids understand, what does this wheelchair do? What does the device work? How does this breathing machine work? How do we use a communication device? Help them feel more comfortable with it, to where if they are going to engage with a parent or a grandparent around these devices, they have a sense of, oh, I've done it, without having someone in the device worried about hurting them while they're using it, right? So this is an example of what the kids tell us in a research context we're immediately applying to programs and supports and ways to really engage the family. So I have quite a few more slides, but I only have another minute left. But some of the things that we're taking out of this is specific skills. And I'm working now with the National ALS Association to really engage and develop educational materials that are targeting families as a whole and youth specifically. So talking about how to engage families around what are the needs as far as training around caregiving supports, how to help families talk about ALS. If there's one thing we've certainly found in all of these interviews is that it's not an easy thing to talk about, and that's certainly something we probably didn't have to conduct interviews to figure out, right? But that youth are pretty extraordinary, and they access information in a variety of ways. But one of the things that they say very clearly over and over is that they really do want to talk to their families about it. But the youth don't often know how to talk about it, and then in the interviews with the parents and the grandparents, they don't often know how to talk about it. So one of the things that we're really interested in doing is developing supportive tools and guides for families on how to have that conversation, how to really engage those youth, whether they're caregiving or not, but really engage them around what is ALS and how to make them feel a little more comfortable and how to make you feel a little more comfortable as the adult in the home. And the key takeaway is to be able to normalize that situation. There goes my timer. To really be able to normalize the experience of having ALS and living in a family with ALS, and help those kids be able to talk to their friends, to their schools, to their community about it. Because once they're comfortable with it, then they can really be able to engage with other people around it as well. So my time is up. Oh, I can keep going? Lori says I can keep going. That's a bad idea. That's okay. But so I thank you all so very much. Quite a few of you participated in the surveys here in Wisconsin. If any of you are interested in being a part of the study, which is just an extension of what we did here in Wisconsin, I would be thrilled to talk to you about it. I'm going to be downstairs with the kids all day. So please feel free to come downstairs, come see what we're doing. Feel free to find me at any point, ask me any questions. I'm happy to provide any information. And again, if any of you are interested in being a part of this research, and it's something I'm very near and dear and passionate about, so if anybody's interested, please do find me. Thank you so much.